Overview: malaria is a life-threatening disease spread to humans by some types of mosquitoes. It is mostly found in tropical countries. It is preventable and curable. The infection is caused by a parasite and does not spread from person to person. Symptoms can be mild or life-threatening. Mild symptoms are fever, chills and headache. Severe symptoms include fatigue, confusion, seizures, and difficulty breathing. Infants, children under 5 years, pregnant women, travelers and people with HIV or AIDS are at higher risk of severe infection. Malaria can be prevented by avoiding mosquito bites and with medicines. Treatments can stop mild cases from getting worse. Malaria mostly spreads to people through the bites of some infected female Anopheles mosquitoes. Blood transfusion and contaminated needles may also transmit malaria. The first symptoms may be mild, similar to many febrile illnesses, and difficulty to recognize as malaria. Left untreated, P. falciparum malaria can progress to severe illness and death within 24 hours. There are 5 Plasmodium parasite species that cause malaria in humans, and 2 of these species, P. falciparum and P. vivax, pose the greatest threat. P. falciparum is the deadliest malaria parasite and the most prevalent on the African continent. P. vivax is the dominant malaria parasite in most countries outside of sub-Saharan Africa. The other malaria species which can infect humans are P. malariae, P. ovale, and P. naulaceae. Symptoms: the most common early symptoms of malaria are fever, headache and chills. Symptoms usually start within 10-15 days of getting bitten by an infected mosquito. Symptoms may be mild for some people, especially for those who have had a malaria infection before. Because some malaria symptoms are not specific, getting tested early is important. Some types of malaria can cause severe illness and death. Infants, children under 5 years, pregnant women, travelers and people with HIV or AIDS are at higher risk. Severe symptoms include extreme tiredness and fatigue, impaired consciousness, multiple convulsions, difficulty breathing, dark or bloody urine, jaundice, yellowing of the eyes and skin, abnormal bleeding. People with severe symptoms should get emergency care right away. Getting treatment early for mild malaria can stop the infection from becoming severe. Malaria infection during pregnancy can also cause premature delivery or delivery of a baby with low birth weight. Malaria can be prevented by avoiding mosquito bites and by taking medicines. Talk to a doctor about taking medicines such as chemoprophylaxis before traveling to areas where malaria is common. Lower the risk of getting malaria by avoiding mosquito bites. Use mosquito nets when sleeping in places where malaria is present. Use mosquito repellents containing DEET IR3535 or Icaridin after dusk. Use coils and vaporizers. Wear protective clothing. Use window screens. Treatment: early diagnosis and treatment of malaria reduces disease, prevents deaths and contributes to reducing transmission. WHO recommends that all suspected cases of malaria be confirmed using parasite-based diagnostic testing. through either microscopy or a rapid diagnostic test. Malaria is a serious infection and always requires treatment with medicine. Multiple medicines are used to prevent and treat malaria. Doctors will choose one or more based on the type of malaria, whether a malaria parasite is resistant to a medicine, the weight or age of the person infected with malaria, whether the person is pregnant. These are the most common medicines for malaria. Artemisinin-based combination therapy medicines are the most effective treatment for P. falciparum malaria. Chloroquine is recommended for treatment of infection with the P. vivax parasite only in places where it is still sensitive to this medicine. Primaquine should be added to the main treatment to prevent relapses of infection with the P. vivax and P. ovale parasites. Most medicines used are in pill form. Some people may need to go to a health center or hospital for injectable medicines. Antimalarial drug resistance over the last decade. Partial artemisinin resistance has emerged as a threat to global malaria control efforts in the Greater Mekong sub-region. WHO is very concerned reports partial artemisinin resistance in Africa, confirmed in Eritrea, Rwanda, Uganda, and most recently Tanzania. Regular monitoring of antimalarial drug efficacy is needed to inform treatment policies in malaria endemic countries and to ensure early detection of and response to drug resistance.